Welcome to our webinar on health metrics for endurance athletes. So on the call today, we have Kurt Lockhart of Transformation Lab and Dr. Jake Devolder of Transformation Clinic. I know a bunch of athletes on the call know who you guys are. Kurt leads Transformation Lab, which is a health and performance lab that offers access to tests like DEXA scanning, RMR, and VO2 max testing. He holds certifications through the American College of Sports Medicine and the International Society of Sports Nutrition. Dr. Jake, he started Transformation Clinic, which offers the Fusion membership, which a few athletes on the team take advantage of. So it's a comprehensive care program for those looking for a proactive and personalized approach to healthcare. And he earned his MD and Master's of Education degrees at Vanderbilt and then stayed on at Vanderbilt for his residency. And he's a board certified internal medicine doctor. So today we want to cover some important health metrics for endurance athletes, but everybody feel free to hop in as usual and ask questions. Feel free to send questions in on the chat. I documented some from athletes who can't attend, but yeah, it's good. We'll definitely carve out some time for Q&A as well. So Jake and Kurt, feel free to take it away.
Yeah, thanks for having us, Conrad. I think this is the third year we've gotten to chat with the team as a whole. First year was out at the Montgomery Bell camp, and then Dr. Jake and I were on a webinar around this time last year. And so, just to give a little bit of backstory about how Dr. Jake and I connected, what we were starting to see is really this movement between exercise science and medicine. Right? I think if you go down to there's quite a few universities that are starting this now, but particularly the one I'm real familiar with is down at UAB, down in Birmingham. They have now this whole wing and laboratory devoted to exercise as medicine. And historically, we've really operated, all right, your medical field is over here, your exercise practitioners are over here. And so we saw, really a convergence of these two things, particularly with the new model of medicine. And so we came together with this idea for this fusion membership where, my expertise being on the exercise science side, his expertise being on the care side, and that we would really bring these two models together for a forward-thinking care as well as, being able to track and test data here in the lab. So what we want to cover today, and we're going to get into it pretty quick here because I want to make sure we have time for questions at the end, is we just wanted to cover 8 of the top health metrics that we think endurance athletes should be aware of, and we'll want to track and monitor, and then just get into a little bit more detail on each of those, why we see them as important, and just be some of the things to be looking out for in your own care journey. So I'm going to go ahead, reshare my screen here. Okay, perfect. I'm going to let Jake kick things off here. Dr. Jake will go into a little bit more about lipid panels and some of the blood work that he looks at.
All right. Thanks, Kurt. Thank you, Conrad. Yeah, we're going to start off with the advanced lipid panel, which kind of in more lay terms would be like your cholesterol levels. And this might be a little bit counterintuitive for endurance athletes. I suspect y'all have pretty low, lifestyle risk factors. You're active. I assume you're eating pretty well. I doubt you're smoking. But I do think there's some, specific considerations around this that I think make this really relevant to you all. And one of those things is the fact that we are seeing a higher prevalence of some coronary artery calcifications. So actually calcifications of the arteries that are carrying blood back to the heart muscle, seeing a higher prevalence of those in endurance athletes. And we think that's probably due to just the sheer stress. Y'all are pumping a lot of blood down those arteries, and just the sheer stress of that blood flowing against those walls can be potentially damaging, and then also some oxidative stress as well. We don't know for sure what the clinical significance of this is. Again, endurance athletes are otherwise pretty healthy people, and so we're not necessarily seeing a bunch of athletes having heart attacks because of these calcifications or leading to them needing stents or things like that. But when you add in high cholesterol levels with this propensity to develop calcifications in these arteries, I do think you are putting yourself at risk for kind of a two-hit model of damage. And so I think it's really important to measure those cholesterol levels so you can have a better understanding of what your risk might be, so that you can work on mitigating it. And again, I think it may be counterintuitive. Y'all are eating well, really active, high cardiorespiratory fitness. So why would your cholesterol levels be high? But unfortunately, there is a really high heritability to cholesterol levels. See people that take really good care of themselves, do everything, quote unquote, right, and still have high cholesterol levels, high enough that we would maybe clinically be concerned. And so that's why I think it's important to measure these things. And I do that with a more advanced lipid panel. So that includes kind of your standard things that you might see on a normal cholesterol panel. So the total cholesterol, HDL, the LDL, your quote unquote good and bad cholesterols, your triglyceride levels. But I like to add in a couple other metrics that I think are really important here. One of them is called an LP little a. This is entirely genetically determined. There's not really anything you can do lifestyle wise to increase it or decrease it. It just sort of is what it is. And it's important to know because it can be a risk amplifier, basically. If it's low, it means that the cholesterol particles that you do have are not as likely to be disease causing. And if it's high, it suggests that you do have some more disease prone cholesterol particles floating around. So it's a good thing to know just for assessing your risk. And then I also like to check an ApoB. This is a pretty similar test to an LDL cholesterol. It's looking at a similar thing, just from a slightly different angle. Most of the time, those two tests agree with each other, but there are instances where they are what we call discordant. One will be high and the other one will be low. And the data actually shows us that when they are discordant, that the ApoB is a better predictor of risk. And so I always like to be sure to include that as well, just so we're not missing anything in that risk kind of equation that we're looking at. So again, I think just an important thing for endurance athletes to be aware of their cholesterol levels, just some of the cardiac implications of y'all's sport, and then just making sure you're not having a blind spot here in your lipids, your cholesterol levels that could be potentially be putting you at risk down the road.
So we transition out of the lipid panel. We're going to stay kind of in that realm, and particularly talking about omega-3 fats. And so one of the metrics that we're big on understanding is the omega-3 index. And what the omega-3 index is, it's a measure of the key long-chain omega-3 fatty acids. So particularly, we're looking at EPA and DHA within the blood. Now, when you get omega-3 index test done, it's going to be expressed as a percentage. So essentially, we're going to look at, all right, of the total fatty acid content, what percentage are these long chain EPA and DHA that have really been shown to have a number of health benefits, which we'll discuss in just a second. And this test is one that's pretty easy to do. Generally, you can do it with other labs, or you can do it as like a dried blood spot test that you mail off. But this is just an example of what an index would look like. And what we see a lot is certainly with us being a landlocked state and not having a lot of access to fresh wild caught seafood or really the like not a lot of algae and other things in our diet, even on the vegan and vegetarian side, is that we tend to see the omega-3 index run a little bit lower. And when we think about some of the benefits of omega-3s, we know from a performance and recovery side We're going to see some of the joint health benefits, looking at cartilage synthesis improvements, improvements in inflammatory response, particularly when we start to get into like chronic kind of low-grade inflammation like osteoarthritis. And then the new frontier really when it comes to omega-3 research is cognitive function. So thinking about it just strictly from a performance and recovery side, those are a few things to consider. And then looking at it from more of a health span side, and I use that word, it's, love them or hate them. It's one that, Dr. Peter Attia made really famous. But I think the point here is that, yes, we're looking at the amount of years that we're living, but we're also looking at maximizing the quality of those years. And so if we look at, omega-3s, pretty well established research in terms of the reduction in risk of all-cause mortality, as well as particularly death from cardiovascular disease and cancer, and then a reduction in our type 2 diabetes and improvements in our insulin profiles. So kind of looking at it from both a performance and health synergy is certainly something that we want to be aware of with our endurance athletes. And this is the big one with this is I think a lot of people just, they'll go in and they'll supplement with omega-3s, which is great. The analogy I always use is the lawn care analogy for me is I take great pride in my front lawn. I try to have the greenest grass on the block. And I have two parents that are plant science majors, so I know that in order to do this most effectively, at the beginning of the season, I should just dig up a little sample of the soil, take it off, send it off to the lab, or take it to the Davidson County Co-op and get the soil tested, so I actually know what I need to provide to that soil. But admittedly, unlike a lot of us, I don't do that, right? I just kind of say, oh, this is what I did last year, or this is what generally goes in this particular region. And so I oftentimes I'll end up either being inefficient or really having no idea whether or not I'm actually doing the right thing. So I understand that sometimes it feels like a high barrier of entry to this, but particularly with like the omega-3 index, it's very, very simple test to get done. You could do it with blood panel. You can order it on Amazon Prime. I mean, there's numerous ways to get access to it. And I think when we look at the importance of this, it's one thing if my lawn goes brown and, doesn't look great, in the summer months or whatever. But when we look at it from a health perspective, the stakes are, of course, much higher. And this is where one of the things that popped up a few years back is we started to see some research around omega-3 intake and an increase in atrial fibrillation. And so that was, very counter to what was originally thought of when it comes to omega-3s, which was that they're very, cardioprotective, and they do show a lot of those benefits. But with a lot of things, we talked about this, Conrad, on our roundtable with I believe it was like sodium levels. We have sort of this U-shaped curve, right? So we have we have this sweet spot of intake when it comes to our omega-3s, to where a lower intake, we're going to see benefit. We're going to see an increase in AFib risks. So we see, if you have a very low omega-3 index, and then potentially if you have an overconsumption, we could see some altering in the membranes. Again, I don't say this to scare anybody because this is a very small sample size. It was statistically significant, but it's not usually a day-to-day concern for most folks. But the point being, like, there is potential that we could overshoot our metrics. Plus, we just want to be efficient about what we're doing from a supplementation standpoint. So I think it's really important to get that measurement done. That way we have an understanding of, hey, where is our omega-3 index at? And then we can address accordingly through potential supplementation. So again, two big things here. We want to know what that sweet spot is, and then we want to understand the impact of the intervention that we're putting in play. And so one example, not to pick on Costco here, I love Costco, but this is one of the fish oil products from there. And when we look at the omega-3 profile for this, a lot of times when you look at omega-3 supplements, you'll see a value or a total value on the front. And so if we kind of zero in here, we can see the fish oil, 1 gram of fish oil, 1,000 milligrams of fish oil on the product. And so that's the total oil. And then we go in here, we see, all right, of that 1,000 milligrams, about 25% of that was the EPA, DHA. So these, long chain fatty acid, omega-3 fatty acids that make a big difference. And so in this case, it's only about a quarter of the total fish oil. So whether or not the label, gives us this information, or whether or not, even if it was a higher percentage potentially of EPA, DHA, we want to be able to test, hey, is that having an impact on our concentrations within the blood? So usually we would shoot for something that had more like, 75 or 80% EPA, DHA, just so you're avoiding some of the side effects of fish oil supplementation, maybe fish burps and the like. But ultimately, the goal here is to increase those blood levels. And so that's where the testing comes in to really identify, hey, are we actually completing the desired outcome from our intervention? Which will take us over to vitamin D next, and I'll kick that over to Jake.
Yeah, so vitamin D is another one that I really think is important for everyone, but I think has some special considerations for you all as endurance athletes, looking to optimize your performance. And it's important to check because deficiency and insufficiency is really quite common at this latitude and further north from, at least for where we are here in Nashville, but quite common throughout the US. So vitamin D works. It's got kind of multiple really crucial functions throughout the body. At the level of the muscle cell, it binds a vitamin D receptor on the surface, which then activates a cascade of events inside of the cell. Some of those are genomic, so it's upregulating or downregulating certain gene expressions in the DNA, and some of those are non-genomic. And so inside the muscle cells, it's really important for managing calcium levels. So it upregulates several enzymes that are involved with, calcium homeostasis inside the muscle, calcium storage inside the muscle cell. And then a non-genomic effect is that it helps modulate those voltage-gated calcium channels that help allow that rapid influx of calcium, which is crucial for muscle contraction and generation of the nerve impulse and then the muscle contraction. So important for sport there. It's also active in cardiac muscle and smooth muscle. So in cardiac muscle, you're getting kind of similar effects. You're getting more contractility of that heart muscle, so pumping more blood forward with each beat. And then in the smooth muscle, it actually helps stimulate nitric oxide. So it's actually vasodilatory, and it can improve blood flow. So between the improved contractility of the heart and the vasodilatory effects in the blood vessels, you're really improving your blood flow and your oxygen delivery. So all these come together to promote or optimize, muscle function, muscle performance. So important role there. Further inside the muscle cells, it's also really important for mitochondria. It supports our mitochondria, which, if it's been a while since you had cell biology, those are organelles inside the cells that are responsible for ATP production. It's where fatty acid oxidation occurs. And so vitamin D here stimulates the production of more mitochondria. So it increases your mitochondrial density. And it also stimulates the production of the enzymes that are involved in what's called the electron transport chain, which is how we generate ATP ultimately from fatty acids inside the mitochondria. It's also upregulating the enzymes that are bringing in the acetyl-CoA from those fatty acids that are being oxidized into the mitochondria to be turned into ATP. So, On the one side, we're optimizing our O2 delivery by those effects in cardiac and smooth muscle. And on this side, we're optimizing the O2 utilization by having more mitochondria that have increased capacity for fatty acid oxidation and ATP production, both of which can, really help boost your VO2 or help optimize your VO2. It's also really important for on the recovery and repair side. So it's got a pretty potent effect in the immune system and can kind of help dampen inflammation, reduces the oxidative stress that can come when y'all are, competing or training really hard. And so that helps reduce muscle soreness and reduce recovery time. Also helps protect those mitochondria from oxidative damage from doing all of that metabolizing of those fuels. And it helps mitigate some of the risk, like cardiac fibrosis and some of those atherosclerotic changes that we talked about uh, in the lipid panel section. The online also has a bit of an anabolic function, so it stimulates muscle protein synthesis and actually increases muscle 2 or type 2 muscle fibers. So pretty broad-reaching effects, including bone health, which is maybe its most common or most well-known role, which I think is a good segue over to Kurt here for his next metric.
Yeah, and I think here with vitamin D, much like we were talking about with the omega-3 index, is it's a test don't guess type of situation. So we want to understand what the level is and how we can optimize that level accordingly to a patient's goals and outcomes, training schedule, etc. So that's really I know something that Dr. Jake includes with his panels and definitely want to keep up with from just a day-to-day standpoint. On the bone density side, we know vitamin D being a big regulator of our bone metabolism. And so one thing when we hear a lot about endurance athletes, there's sort of these pre-existing concerns that drive us to really want to better understand bone density in these athletes. And so, we talk about something that is, I'm sure all endurance athletes have experienced is just low energy availability, right? There's huge demands in the sport, and we're working with our busy lifestyles, etc. So we're oftentimes fighting that battle of how do we get enough calories in to support that day to day. So most all endurance athletes have undergone a period of low energy availability. We look at the genetics. So we sort of gone away from this in the science world. The old you used to see the skinny guy, right? The ectomorph, the endomorph, and the mesomorph. The body somotypes, right? We really don't see that categorization used, at least not very prevalently anymore. But there are some, underlying truths to these genetic makeups, and so oftentimes people that have a leaner build and would maybe be drawn to an endurance sport because of their body's makeup, their muscle fiber types, etc. They may also be somebody who is at potentially risk for lower bone density. We have the hormonal imbalance side of it, particularly thinking about the demands of training, the recovery demands. We have the female athlete triad, which is something that impacts our female athletes very significantly. And then particularly to multi-sport athletes, we have, a crash risk as well. So a high trauma potential there within the sport. So, looking at that, it all really boils down to on the bone density side, do our metabolic demands significantly exceed our mechanical loading? So when we think about, the different sports that may be at risk, one we know for sure it's been shown in the literature is cycling. And very simply, it's because there's huge metabolic demands and, not being as much of a weight-bearing activity, the mechanical loading is quite a bit lower. Swimming, the research is still pretty mixed on, but there is some thought that we're seeing lower bone density in, competitive swimmers, and triathlon as a whole is just still quite a bit of mixed research, but we'll see some studies that say, hey, we're seeing bone density scores equal to or lesser than sedentary individuals within these athletic groups. And then on the other side, we may see more normal scores. So I think it's worth considering, and it's such a low barrier to entry. This will be a shameless plug for getting a DEXA scan done as part of your annual physical. I think that's one that Dr. Jake and I really have wanted to bring to more people here locally in Nashville, but also, even if you're elsewhere in the country, in the world, have a talk with your care team about it, because it's such a low barrier to entry. It's a 6-minute scan, very simple. We get a bone density reading, and we'll get body composition data. So very, very useful tool. And it also just helps us understand, is this person at risk? I mean, bone density is really a trajectory game. So when we look at, some of the scoring on bone density, if you look at the chart here on the right with the green, yellow, and red, what we see is we're actually, able to see where somebody is at in terms of their bone density. And then we project, based off of the traditional aging trajectory, where that person might end up at down the road. And so it allows us to really see, hey, maybe this person's bone density is solid now, but if they follow the traditional aging trend, maybe they'll get into the yellow or the red zone, maybe the osteopenia or osteoporosis zone later on into life. And so if we can do just a small change in that trajectory right now, it can make a big difference for that individual down the road. So if you go and get your bone score done, bone density scan, then you'll get 2 scores typically. One is a T score, which is going to compare you with a young adult, what we call a young adult normal score. So it's a 30-year-old in your same ethnic group. And then you'll also get what's called a Z score, which is going to compare you to an age-matched person within your ethnic group. And both of these scores are, traditional standard deviation score. So if you're like me, I always have to, go back to stats class of many years ago and, pull up an old bell curve just to kind of see where that distributes somebody at. But essentially, if your T or Z score is lower than -1, then we want to just be aware of that trajectory chart for that individual. So you're talking about people that are in the bottom 15% or so of that population. It's worth keeping an eye on, certainly, because particularly in our athletic demographics, if we're seeing that lower score, it's likely we're going to also see a lower trajectory later on into life. So really, that's either T or Z score you could use, but just as a very general rule of thumb, keep an eye on things that are lower than -1, and having a talk with your physician about it if that's the case, and see if there's anything that can be done to potentially alter that trajectory.
Yeah, and then next we're going to talk about looking for anemia and assessing your iron stores. This is important for athletes, endurance athletes. They'll have some risk for iron loss or potentially some increased demands for iron. And that can come from foot strike hemolysis. It can come from, small little GI microbleeds that can occur after, long events or long training sessions. And you even lose trace amounts of iron in your sweat. But, cumulatively over time, that can add up. And we do sometimes see endurance athletes have troubles with anemia or low iron counts. And this is important because iron is a mandatory factor in hemoglobin and myoglobin, which are the oxygen transporters in your blood and your muscle cells, respectively. Iron is also an important cofactor for multiple enzymes in aerobic metabolism. So it's also really important for that fatty acid oxidation, burning fats for fuel. And so when we're looking for these, few things that I like to look at. One is your complete blood count. So this is looking at your white blood cells, red blood cells, and platelets. But in this context, we're especially interested in the red blood cells, particularly looking at how much hemoglobin you have, that oxygen carrying molecule in your blood. And then what's called your hematocrit, or sometimes referred to as a packed cell volume. And that's just sort of looking at what percentage of your blood is comprised of those oxygen carrying red blood cells. I also really like to look at what we call your red blood cell indices. And so this is basically just looking at the size, the shape, the color of your red blood cells. And this can give us some insight into multiple different micronutrient deficiencies. There are a few that are pretty characteristic for iron deficiency or even just functional iron deficiency. And so I always like to take a look at those. And then and the athletes I work with, I just go ahead and we'll check iron studies right up front. And so that's looking at free iron in the blood. It's looking at a storage form of iron called ferritin. And it's also looking at something called a transferrin saturation. So of your iron transporting molecules, how much of them have iron bound up on them. Just to get a full picture kind of your iron status, your iron stores, how your body's utilizing iron. And again, it's important to check. That way you know you may have plenty of iron and not need to make any changes. Or it may be that you need to figure out how to get some more iron in your diet, or even supplement. Iron supplements are sometimes not all that well tolerated, and so you don't want to take one just if you don't have to. And you don't know unless you check. So pretty standard part of the panels that I run, and I think important for athletes. I think someone had submitted a question ahead of time about iron supplementation, particularly timing of it. And whether it's supplementation or just an iron-rich meal, you do want to try to separate that out from a race and a competition, a heavy training session, because heavy exertion does increase a molecule called hepcidin, which actually reduces intestinal absorption of iron for about 6 hours or so. So if you are, consciously trying to eat more iron-containing foods, or you are taking an iron supplement, I would time those for kind of the day before, a heavier training volume or a big event, or wait until, the next day or a couple days later when you're really recovered. If you take it on those days when you're going to be really active, then you're likely to not absorb it, and it'll just pass on through.
Iron is definitely one metric that there are two athletes that I can think of right now who I coached over the years, and they taking an iron supplement transformed their fitness. One athlete, it was just a couple weeks, he was like feeling sort of down, couldn't perform, etc. And it's like, well, let's get the iron checked, really low. And it's one of those things like in a couple of weeks, it was like a 180. And then another athlete we didn't really know, but his levels were extremely low, like borderline dangerously low. He had to go in and get multiple injections.
Yeah.
And then it took a couple of months, but we saw an FTP increase of 10% plus.
Yeah.
So it's important. It's definitely worth getting it checked.
It
Just
is important.
drive that
Yeah.
home.
Yeah, and even if it's not to the point that your hemoglobin is low, even if you're not anemic yet and your iron levels are just low, it can take time. You can burn through all of your iron, and your body's trying to make a normal amount of red blood cells. But once you've kind of run yourself through your iron, you may still have normal levels of hemoglobin and red blood cells for a little while. But even in that period, because iron is such an important cofactor for, those enzymes that I talked about, but also like multiple other uh, uh, systems in the body, it can have a lot of, particularly energetic effects, even without the oxygen carrying deficit. So, for sure.
So next we'll transfer over to heart rate variability. And we had a couple good questions about this, so I'll do my best to cover them as we're walking through. Uh, I know that I'm talking to a crowd of endurance athletes, but just as a real basic level, when we look at HRV or heart rate variability, what we're looking at. So you watch your famous favorite crime scene show or daytime soap opera, right? You get the person who's kind of in their hospital bed on their taking their last breath, and you see the EKG pop up there on the screen. And really, the big peak within that EKG. So you have the QRS part, and then the R is that very top of the peak of the wave. And so what we're measuring with heart rate variability is basically the small kind of micro differences between in time between these peaks or these R peaks. And so ultimately, what we're trying to assess by measuring heart rate variability is to better understand the body, and particularly what we refer to as the autonomic nervous system. So we're in the most simplest terms thinking about it as this tug of war between, more traditionally we would say fight or flight on one side, and kind of rest or digest on the other side, the sympathetic versus the parasympathetic, and kind of see, all right, well, where is that body leaning based off of the variability in our heart rate? And so when we look at this, the questions that we had, come in were, number one, how can we make the most of HRV? And then number two was, how reliable of an indicator of fatigue is HRV? And these are both, I think, really, really, really good and popular questions. The biggest thing about HRV that I see is it's just a really misunderstood metric from both a data collection standpoint as well as like actually how to use the data standpoint. So I want to walk through a couple things. First of all, I rarely will recommend you go and just read a whole paper, but this one is well worth reading if you're interested at all. It's done by Dr. Ludstrom up at the University of Minnesota up there in the Twin Cities, their School of Exercise Science, Kinesiology. And it really does a nice job of summarizing the data that we see used in application day to day, and whether it's high level sports teams or other labs that are doing research in the field. And I'm going to do my best to give you just some, we could do a whole webinar on HRV certainly, but just kind of some of the basic takeaways from this, and then talk a little bit more about some of the steps if you want to implement HRV into your decision-making process as an athlete. So, first things first is, from the literature out there, our measurement tool, highly recommend, either doing an EKG, which most people aren't going to have access to day to day, or using a chest strap monitor. And we really want to get what we call an active HRV measurement. So a measurement that is, taken in a specific position rather than this, sort of background HRV reading that we might get in some of the wearables. Maybe an overnight HRV that's taken all throughout the night, or a daily HRV that's taken over time, right? We call it an active measurement, meaning we want to just get a really focused time where we're conscious of trying to measure our HRV at that moment. For most people, time of day that's going to be ideal is to do it in the morning, first thing, after you've stirred. So get up, go to the bathroom, move around for a couple minutes. And then you would want to go ahead and take that active HRV measurement. As far as body position goes, for most people on the call, you're going to have a lower resting heart rate. So the best position for HRV is going to be actually in the seated position. If you've got a whole log of data in the lying position, then you want to be consistent with whatever position that you're doing. So don't go from lying to seated to standing and expect that your HRV readings are going to be kept consistent. So we got to keep our body position the same, ideally in the seated position for most endurance athletes. And then as far as how long we need to take the measurement, anywhere from 1 to 5 minutes. 1 is sort of the minimum that we need. Once you get above 5 minutes, you're not gaining a whole lot of additional accuracy. So somewhere in that 1 to 5 minute range is what we want to target with the time of the measurement. And then when we think about, the practical application, so if you are going to use HRV in your training decisions and that we really want to follow a process. So number one is to establish your baseline. So it doesn't matter what Bobby's baseline, Billy's baseline, Sarah's baseline, like you need to establish your HRV baseline. And so that means that really, if you've never monitored HRV consistently, you need to take at least 3 or 4 weeks of data following those exact protocols from the last slide and make sure you have a robust enough data set to like actually start understanding, what your baseline is and what, some of your parameters are. And then from there, you can start to, sit down and identify, any pertinent trends in the data. So, am I seeing, maybe Thursday is my track day, high intensity day. Maybe I'm seeing a dip in HRV consistently on Fridays and Saturdays. Maybe not, it may not be that clear cut, but we can go in and just sort of start to identify some trends that could be impactful to programming. And then third, start to set some guardrails on HRV. And I highly recommend, doing this with your coach, because one thing I have a lot of people talk to me about in the lab, and we saw this actually on a research call a month or so ago, is that it is true that people following like HRV guided training programs, there is some decent research out to say, hey, they had better outcomes than a predetermined training plan. But I think what a lot of people forget is the predetermined training plan didn't have a coach with it, right? That's really important. They just had a program that was written out with no human oversight or intervention. And so the comparison there is basically, all right, if I follow this HRV guided program versus just a set program, yeah, maybe the HRV is a little bit better because at least it's making some adjustments. But the comparison is very rarely to a coached plan, to where you might have that coach that's able to see other data trends and make those adjustments. So get with your coach, set some guardrails, say, hey, how am I going to actually incorporate this? Because some people may do it like day to day and adjust their training day to day, but I think actually the most beneficial I've seen it is looking at, multi-day trends. So yeah, if somebody's HRV is sort of, declining week over week, or maybe it's, if there's been 3 days of a pretty sharp downturn, then we might start asking some additional questions. Hey, what's going on here? Why are we starting to see this trend? But we'll never know that unless we have a really good, data set to work off of. And then fourth is we want to, sync this HRV with some of our other data. So, could be any other number of metrics. Could be your, sleep and recovery pieces. Could be your heart rate at different intensities during training, et cetera. And so that's when it really becomes powerful, as now we have, multiple data points that are telling us a similar story. So to circle back, I think how reliable of an indicator of fatigue is HRV? Well, if you're monitoring it well, it's a pretty good indicator. Like if we see a downturn in HRV where the body is allocating resources, elsewhere essentially. So I think when we think about HRV, we really want to get away from looking at HRV as a predictor of performance, i.e., my HRV is low today, I'm not going to perform well. My HRV is high today, I'm going to perform great. And more just thinking about it as, hey, like, how's the body allocating particularly recovery resources? So I think that's where a lot of people get, off the rails when it comes to HRV. And most people don't have enough true data in their database to really make informed programming decisions when it comes to HRV.
That's a good point. I know that it's easy as endurance athletes to look at HRV and obsess over it, especially race week. I get many people reaching out. It's like, why is my HRV, so off? It's like it's okay. Your HRV might be low and taper. It's influenced by many things, but it does not indicate your potential to throw down a good race or something like that. It's like a separate thing. So we also don't want to overthink it if HRV is low going into a key race.
Absolutely.
We're gonna roll on into looking how we assess kidney function. Again, important for endurance athletes, just because um, y'all do put some stressors on your kidneys. We're born with a lot of reserve renal function, and we just naturally will lose that as we age. We're sort of exposed to toxins or illnesses or events that kind of ding or injure our kidneys. And we just kind of slowly whittle through some of that reserve over time. The goal is just to maintain as much of that, kidney function as long as you can. Many people develop what we call stage 3 kidney disease in older age. It's pretty normal. It's almost not really a disease because it is so just the normal trajectory of human life. But it is probably avoidable if you pay close attention to it and protect that kidney function for as long as you can. Um, as athletes, in its extreme form, rhabdomyolysis, but even in less extreme forms, just some of the products that get released from muscle cells when they're injured or damaged in, after prolonged or strenuous activity. Uh, those products can end up in the kidney, the filtration system in the kidney, and cause damage and toxicity. And there's an acute phase of that, which is reversible, and then there can be some chronic phase, which is less reversible or not reversible. And then if you kind of stack injuries like that on top of each other over time, can see that reserve kidney function be whittled away a little bit faster. Dehydration can also be really rough on the kidneys. This is a bit more reversible, but if you are pretty frequently or chronically dehydrated, that can over time also whittle away at that reserve kidney function. Again, in all of these things, there's some acute phase that is reversible, but the chronic stages of it, the chronic bits of it, you aren't able to regain that back. You can't grow more of those kidney filtration units that we call glomeruli. And so we check these just to have a sense of kind of where you're at and know how serious we need to be about protecting. We should always, think about protecting our kidneys. But if it's something we need to move as like top priority now, or if it's something that we just need to, kind of remember to think about from time to time. It's really cumbersome to actually measure your kidney function directly. It's not something that you want to do or go through. And so we actually estimate it. We estimate your glomerular filtration rate, or your GFR. That's typically done with a blood test called a creatinine. Creatinine is really susceptible to artifacts based on hydration status, based on muscle mass, based on creatine supplementation. And so I always like to add in another biomarker called a cystatin C. It also has some things that can introduce some artifact into the system that are a little bit typically less pertinent for endurance athletes. So I think it's a better marker to use for estimating. And really, there are formulas that bring both of those together, the creatinine and the cystatin C. So that's typically the formulas that I rely on. But this is a simple blood test. I do it pretty much every time I check any of our members or the athletes that I work with, their labs, just to really keep close tabs on that kidney function. It'll go up and down hourly, daily, but it's really about kind of seeing that trend over time, figuring out what your baseline is, and seeing if you're kind of straying from that baseline over time.
Last one, I'll cover this one pretty quick because I want to get to some time for questions at the end. But this, I debated on putting this one in as a health metric, but I think it is really important, and I think it's really, really important for endurance athletes, and that's to have some sort of movement screen done. I recommend the FMS or the functional movement screen. If you've ever had an FMS done or seen someone doing it, it's essentially a series of 7 movement assessments. So really going through more of the global movement patterns down to more isolated movement patterns. And then each individual assessment is going to be scored from 0 to 3. So basically each of the 7 movements gets scored depending on the individual's ability to perform that movement and the proficiency in which they're able to do it. Another just side note is the FMS is also called the SFMA. So used by, depending on what type of practitioner is using it, you may see an FMS, you may see a SFMA, very, very similar concepts. And the why behind this is, we want to utilize an assessment that identifies, movement deficiencies, whether those are imbalance related, asymmetry related, or maybe they come from a lack of stability, mobility, or just general motor control. And particularly, when we look at endurance athletes, it's the volume of training, it's the volume of patterns. And then it's also the strength component too. I think, a lot of times when we look at the importance of strength training for endurance athletes, a lot of our endurance athletes don't really have or haven't really had a lot of a movement assessment on the strength side done before, as maybe would have been sort of built into the more youthful progression of like a strength and power athlete growing up through the different levels of competition from high school to college and university, etc. And so I think really before you start getting into a progressive strength program, just going through the FMS can save you a lot of hassle and a lot of potential for injury because it's the one that's really focused on our human movement patterns. So, the stuff we're going to do in sport, but also the stuff we're going to do in life. 2 key notes on the FMS. When you get your FMS back, you'll get, again, a score from 0 to 3 of each, different pattern that's being assessed. But it's really most important to look at the individual patterns and specifically the deficiencies. You'll also get an overall score, which is less important. So, if I'm not going to compare my score to Conrad's score and say, oh yeah, I'm a better mover than you, Conrad, or you're a better mover, whatever it may be, because ultimately you can be a great mover. You can score a 3 on 6 of the 7 tests, but if you score a 1 on the 7th test, then that's the one that you want to work to improve. And so ultimately, we really, our real goal in the FMS is we want to have 2s, which are usually sufficient movement patterns across the board at minimum. And yeah, if we get some 3s, that's great. But we always want to consider in sport, our goal is not necessarily to be a professional mover. It's to do our sport very well and allocate our resources most appropriately. So really using this as more of a deficiency identifier rather than a bragging rights sort of thing. And then just embracing the areas for improvement. I think Conrad hit on this earlier is, not obsessing about, not obsessing about our HRV on race week, right? Not obsessing about our FMS score, but just seeing, hey, where can we improve? Where can we move better? And how can that help us within the grand scheme of our goals?
Yeah, and just to plug, I know last year we had a strength and conditioning offering for athletes in Nashville, group strength training. We're trying to make that happen again this year. I know we announced it. We're trying to get enough athletes to do it. And part of that will include a movement screen, so that we can identify some imbalances and issues there. So that's just a little plug. We're trying to make it happen again this winter. Just local group strength training.
Yeah, super important. Uh, I guess one really final question, and whoever asked this question, I think this is great. So please like stay on after the webinar. I want to like send you a little package because kudos to you for asking this question, because I think it's one that a lot of people would want to ask, but maybe wouldn't ask. And so they ask, hey, is one or two alcoholic beverages per day okay? And so, we're not going to be the practitioners here that are going to be like, oh yeah, it's a vague question. The answer is we're going to let the data answer this question. And so I think what we're really excited about, moving to is, when we have a Fusion member come in, is we put together this health dashboard for them. So the health dashboard sucks up everything from their wearables, so their Garmin device, their Oura Ring, their whatever platform they're maybe tracking their calories or macros in. If they have Apple Health data, it can pull that in. It has data from testing with us at the lab. If they have blood labs, basically we're just trying to suck in everything that we can so that we can both build a robust health history, but also have like a day-to-day monitoring on this individual. And so, what we're really trying to move to, see if you guys can see this okay. I know colors aren't the best, but this is just an example of where we can take all these different data points and we can actually plot, all right, in this case, alcohol intake relative to, in this case, it was just a sample, but AM readiness and HRV during sleep, which again, we probably wouldn't do those two metrics, but just a sample. We could pull in anything. We could look at alcohol intake over the course of a quarter and how that impacted your lipid panel or your renal function or whatever, the pieces that we wanted to pull in. And so what we're really trying to move to is like we can allow the data to answer that question in a care model. So that's really what we want to see is, hey, you can see what's going on. You can see the impact of that 1 to 2 drinks, and you can decide for yourself, hey, is it okay or not, right? Based off of my goals. And that's really how we're trying to approach a lot of metrics right now is let's look to the data. Let's see what the data says. Let's monitor the data and let's use that to help drive our decision making. And really, I think that's the new model of care that at least we're subscribing to, and I think you're going to see a lot more across the board as we move into this world where we see more and more data points more easily accessible. So that is all we have. I know there was a question about wearables. I'll try to touch on that a little bit maybe during the Q&A, but if y'all want to connect with us, we'd love to see you certainly on the lab side. We do DEXA, resting metabolic rate, and VO2 max testing. I cannot believe we got through a whole health metric webinar without touching on VO2 max, but hey, as the nature of today, certainly we can cover it if y'all have questions. If you're interested on the care side, we do have that Fusion membership with Dr. Jake. So that combination of testing at the lab along with care from Dr. Jake. And you can set up a discovery call with him just to chat more about that, if it's a fit for you and kind of what things you're looking for on a healthcare side. And then most importantly, if you have questions, reach out to us, myself or Dr. Jake, put our emails in there. We love talking shop, and honestly, we miss having the working triathlete crew right down the hall. So we'd certainly be happy to chat or answer any questions that you may have. So yeah, with that, Conrad, I will open it up to any questions folks may have.
Anybody have any questions? Looks like Jen asked. Whoops. Hold on. What's the most effective instrument for measuring HRV?
Yeah, so I would use any sort of chest strap monitor. So usually Garmin or Polar is going to be go-to there. Yeah, I mean, if you had access to an EKG around the clock, that'd be great. We could do that, but most people don't. There is Omega Wave is a company that I think they're a Finnish company somewhere over there. But anyway, they have a chest strap that has a little bit of an advanced uh, readout as far as sort of give you like a pseudo EKG, if you will. So I like that. There's a little more of a cost associated with that, but it also measures both HRV and then what's called DC potential, which is a central nervous system indicator. It's a little slow brain wave that sort of predicts the central nervous system potential for that day, in addition to the autonomic balance from the HRV reading. So it gives you just a secondary layer in there that's pretty effective. And a lot of our high level athletes will utilize something like that.
That's cool. The DC potential aspect of that is kind of neat. I never explored that, but that might be a better predictor of race readiness than maybe HRV. Um, but so what software? So if somebody has a Garmin watch, I know some Garmin watches, they just track it. I know Whoop tracks it. Do you use a specific software? It sounds like you use Omega Wave, but if somebody has a strap, is there an app? Do you know if there's an app, just a random HRV app you can attach any heart rate monitor into?
Yeah, the biggest ones I see on the lab side are Elite HRV, very easy, free app. I mean, you can get a premium version, but even the free version is really solid. So Elite HRV is a really good one. That Elite HRV actually sucks up like directly into our health dashboard, so that's a great one for folks to utilize that are seeing us on the care side. The other one that's a little bit more let's put it this way, it gives you a little bit more input is one called Morpheus, and that was Joel Jameson is the guy behind that. He was one of the early adopters of HRV and athletic training, and Morpheus does a little bit more in terms of like adjusting zones day to day based off of a couple different metrics, but it's another one that I see a lot of people use, and actually the algorithms are pretty solid in it. So I don't normally I'm a little hesitant on anything that would do that, but they tend to hit it pretty well with Morpheus. So that's another option that a lot of our clients use.
Okay, cool. And then one question an athlete had who couldn't attend uh, was asking about GLP-1 agonists and sort of what are your initial thoughts on that, especially for endurance athletes? I know there's a lot in there, but what are your thoughts? What have you, I know you've worked with athletes who have been on it and have, had pretty successful outcomes, but what are your thoughts there?
Kick it to Jake to take it first, and then I'll jump in.
Yeah, I guess I'm not too familiar with them being used in endurance athletes specifically. Typically look at using them for weight loss and diabetes, which haven't seen too much in the endurance athletes that I've worked with. Um, more every day it seems like there's new data coming out that shows that there's an additional health benefit kind of beyond just the weight loss itself for this organ system, that organ system. So I think there's something powerful there. But I think particularly with the weight loss, you just have to be really mindful of what kind of tissue you're losing. With rapid weight loss like that, you have to be really intentional about maintaining lean mass, which is important, particularly for our endurance athletes who are also need to be concerned about their bone mineral density going forward and everything. So I think they certainly have a place. I don't know. Have you all seen them used in endurance athletes for some particular goal or?
Well, I think in the context of weight loss,
Yeah.
I guess it's weighing the benefits. What I've heard, obviously I'm not in medicine, but is that there are very little side effects, and that it seems like, at least in the world that I observe within exercise science, is that these things are pretty well tolerated, and maybe they're less not demonized, but they seem pretty, it's impressive. Like the
Yeah,
results are impressive, minimal
certainly.
side effects, and I don't think, I'm not aware of any, direct just like benefits of taking them for endurance athletes specifically from a doping perspective or anything.
Sure,
But
sure.
thinking about the concerns, if an endurance athlete who wanted to lose weight wanted to take them, what would they need to think about, should they be concerned, and the
Sure.
body composition, what type of tissue you're losing, that's a good call out for sure. I know that heart rate can be elevated when you're on them, especially the longer ones. So I guess keeping track of that. But I mean, I haven't heard of any sort of negative side effects of taking it that would, like, apart
Yeah,
from those.
certainly. Yeah. And anyone who's prescribing you them should be asking you this question, but making sure you don't have any strong family history of certain cancers, particularly of endocrine organs, so pancreatic, parathyroid. Um, but that should be a screening question before getting prescribed them. As far as side effects, the most common ones are GI related. So nausea is the most common one, but constipation, even some case reports of bowel obstructions. And then we are seeing an increased incidence of gallbladder issues. So people getting their gallbladders out for um, gallstones or acute cholecystitis. But again, by and large, for the number of people that are taking them, I think by and large they are pretty well tolerated. When you've got that many people on the same drug, you're going to find some side effects. So by and large, they are pretty well tolerated, and I think pretty safe. I think the main concern is for me is just being conscious of that body composition and what tissue you're losing. And then I'll be curious to see kind of long term. There seem to be people who are sustained responders um, and people who are not. And I don't know if we have data that helps us predict who might be sustained responders and who might not be sustained responders just yet. But I'm hoping someone is collecting that data and will have something for us in the nearish future. But
Got it. That's definitely helpful.
Yeah, just real quick piggyback on that. I think it's a very good illustration of the importance of periodizing, training. And so, like, if there's a body composition change goal or a weight loss goal or whatever, making sure that we're not furthering issues by doing that in a time of extreme training volume and load. And certainly considering the low energy availability that we talked about can affect everything from bone density to lean tissue loss, et cetera. Those are big considerations. And then it feels a little bit like CBD stores a few years ago, where it's just like popping up on every street. So making sure that you have somebody to monitor you, not just prescribe it to you, but actually to monitor you and ask the questions, as Dr. Jake was alluding to. I think that's huge too, especially as they can kind of see sort of easy money in that field, maybe, so to speak, for certain practitioners, and that may not come with the highest level of integrity on the back end in terms of the care side.
Yeah, good points. And then Josh asked, what are or are there top three things you see that top performers possess, i.e., high HRV, kidney function, etc.? What do you think?
I will
Maybe
say
the Mac is one that pops to mind, but
yeah, it's not high HRV. It's
right.
certainly I would say, let's see, gotta go three. Whew. Definitely VO2 max if we're in the field for sure. That's a big one. Um, I would say, it's not as quantifiable as a metric, but some of the strength testing and metrics are really important. I think that when I see a multi-sport athlete that has a really has a good deal of muscular strength and endurance, I think that goes a long way in their both longevity in the sport as well as their metabolic health throughout. And we'll see. I see what Jake's three are, but for the third one, I would probably say, yeah. I mean, we could probably go in somewhere on the threshold tolerance, and kind of go in there. I mean, really, it's that it's that ratio of threshold to max and sort of all the integrating factors of that. So I would say, yeah, I would say, threshold percentage, VO2 max, and then strength basis or strength profile is see those things all very solid, then we're going to see a good performer.
Sense.
Yeah, I don't know that I have an answer for that. I think those performance-based metrics probably get best at how you perform. On the care side, I'm trying to look for things that might hold you back. But I don't know that I could pick out, three on that side that say, if you've got this, then you will
Sure.
excel. So I appreciate Josh for giving an out in his question. I don't think that there are a top three.
Was a good question.
Yeah.
Um, and then I guess just quick, I know vitamin D came up really important. It was really interesting seeing how that relates directly to endurance athletes, mitochondria, muscle function, etc. Are there any specific brands that you like, of vitamin D? And maybe the same question for fish oil.
I think it's really important to for a lot of supplements to kind of make sure you're getting a reputable brand and that it's got third-party testing. Vitamin D seems to be one of the ones that's like pretty consistent across the board. Kurt, you can maybe tell me if you know differently from your time um, uh, with mid-10. But I think most vitamin D supplements you can find are going to contain what they say they contain and be reasonable quality. I like one by Gero Labs or Gero Formulas. I think they changed their name a few years ago. I can't remember which one is the current one. But they've got available in 2,000 IUs and 5,000 IUs, which I think are pretty reasonable doses for people to take. And it's pretty affordable. So that's a brand of vitamin D3 that I like. And then on omega 3s, I do think you do want to kind of pay a bit more attention to quality. On that front, again, Kurt, I'd be curious to hear what you say, but I like Carlson's and Nordic Naturals.
Got it.
Yeah, Carlson, I know we have at least a couple omega-3 index improvements over a relatively short-term period with Carlson supplementation. So, it's definitely doing its job as far as increasing the percentage of EPA DHA in those red blood cells. So I think to me, that's a good one of having a couple case studies. Do you think Nordic Naturals is a solid brand as well? And then also, just being cognizant, even just like changing if you eat tuna as an option, right? You can even just like change your brand of tuna potentially and get to a higher EPA DHA. I can't exactly remember whether it's, there's yellowfin, albacore, right? Some of these are pole and line caught versus, other ways that they're being harvested. And so ultimately, there's a lot you can do even just within the whole food spectrum to boost that omega-3 intake.
Anybody else have any questions? Nope. Well, thanks for this. This was awesome. Really, really informative. I think it flagged a lot of things that a lot of athletes are going to, think about and hopefully pursue. And we'll definitely send out a follow-up email and with your contact info and try to connect athletes interested in connecting with Transformation Lab and Clinic. But we appreciate it.
Awesome, Conrad. Thanks for having us on. And certainly, if you ask the alcohol question and you're on the call, stick on. We'll get you hooked up with a little package out in the mail. And if not, I'll have Conrad get me the info so we can get it out.
Awesome. Well, appreciate it, guys. See you soon.
Thanks, Conrad.
Bye-bye.